Early detection prostate cancer is a topic that has been pretty controversial and also a hot-button discussion topic between family practitioners and urologists specifically over the last decade or so. It's kind of a surprise to people what the prostate even is. So the prostate is a small walnut-sized gland in the male reproductive system. It has a reproductive function and is part of the genitourinary function. It can actually get prostate cancer. So the prostate gland can actually develop cancer over its lifetime. And 172,000 American males actually develop prostate cancer every year. The recommendation has sort of been ever evolving, and over the last 10 years, it has changed in its wording. And we are not even really talking about screening necessarily, we're talking about early detection. And what that entails is finding prostate cancer in the prostate gland at an early stage before it has actually spread to other organs. The recommendation includes screening tests. One is a blood test called prostate-specific antigen, or PSA, and the other one, that should be used in conjunction, is a digital rectal exam, which really assesses the contour of the gland, just to make sure that there's no nodules or hard, firm parts to it. The recommendation from the American Urological Association and the American Cancer Society, and since 2017, the U.S. Preventative Task Force, have aligned to actually say that every male between the ages of 55 and 69 should be screened with both of these tests that we just talked about to find prostate cancer at the early stages. The benefit in this particular group outweighs the risks. So benefit would be slight decrease in mortality, number of deaths, and also a decrease in advancing prostate cancer to that stage 4 metastatic kind of grade or stage. The harms that we're talking about obviously include overdiagnosis and false positives, but they also include specific events that could happen, adverse events that could happen, like infection, blood in the urine, potentially needing a hospitalization, or even psychologic effects that the biopsy itself has on the patient. The recommendations all align also on not screening anybody, any males, under 40 or over 70, because just like we talked about weighing risks and benefits, the benefit versus the harm is not favorable for anybody under 40 or over 70. For 40 to 55, there's a specific group of males who actually would benefit from being screened, even though it's not recommended for the general population. And those are males who are either of African American descent or with a family history of a brother or a father with prostate cancer, and specifically because this group of people is at higher risk for more aggressive cancer earlier in life. So the recommendation really distills down to having an open and honest conversation with a primary care provider about whether the patient really needs to proceed with screening.